For married women who already have children, they should see their OBs at least once a year at the minimum. And once they hit 40, then they have a lot of routine checkups to do. Well, at 30, we recommend that all women undergo not only pap smears but HPV testing. HPV testing is a test for the virus, the human papilloma virus, which causes cervical cancer. Because the pap smear is an indirect test, but the HPV tests for the virus that causes cervical cancer. And if you're negative for the virus, then you can wait another 3 to 5 years, as long as you don't change your partners, to do your next pap smear and HPV test. But if you're positive for the virus, then you're at 100 times increased risk for cervical cancer. So all of this can be prevented before it actually becomes cancer. Okay? Now, after you hit 40, you should now do your routine mammography, sonomamography. Unless you have a family history of breast cancer, then you may do it earlier. But usually we start annually at 40 years old. And then you have to screen for fecal occult blood, or you can do your first colonoscopy. Now they're recommending at 35, every 5 years, so 35, 40, 45. And then in between your colonoscopy to check for colon cancer, you can do fecal occult blood to determine if you're passing red blood cells in your stool, which may be indicative of a colon cancer. Now, it's also good to do your blood chemistry so that you can check if your fasting blood sugar, fasting insulin levels, your cholesterol, if you're developing any form of abnormalities in your blood chemistries. And I also check vitamin D levels on a regular basis, because you may have too much, which is not good, or too little. So you have to do a balancing act.